hospitals in northern Gaza is burning.
In Palestine, the right of health is deeply entangled with conflict, poverty, and limited access to medical care. From urban centers to remote villages, the Palestinian system of healthcare is facing immense challenges.
Restrictions on movement, resource shortage, and geopolitical conflict create barriers to critical services, leaving many to wonder, what does the right to health really mean here? Amid this obstacle, a resilient community of medical professionals and volunteers strive to make a difference.
Efforts do not only reflect a commitment to care, but also an enduring fight for quality and dignity.
This documentary delves into the lives, struggles, and hopes of those caught in the intersections of health and humanity in Palestine, because access to care should never be a privilege but a right.
The blockade on Palestinian areas has crippled the healthcare system in profound ways, denying millions their basic right to health. First, the lack of access to essential medical supplies has left hospitals and clinics struggling to provide even the most basic care. From life-saving medication to critical surgical tools, shortages have become the norm, forcing healthcare workers to make impossible choices about who gets treated. Second, the movement of patients is severely restricted. Ambulances are often delayed or stopped at checkpoints, turning what should be a short trip to the hospital into a life-threatening ordeal. For those in critical condition, these delays can mean the difference between life and death. Third, the blockade has led to a shortage of healthcare professionals. Doctors, nurses, and specialists are unable to travel freely, leaving the region with an overburdened and under-resourced healthcare workforce. The result? A system stretched far beyond its limits.
So moving on to supply chain disruptions. The blockade has disrupted supply chains, making it difficult to import essential medical equipment and drugs. These disruptions undermine medical care availability and adequacy and worsening Palestine's highest fatality rate. Next, delays in delivery. Critical shipments of vaccine, blood transfusion supplies or life-saving medication often takes weeks or months to arrive. In the meantime, patients awaiting urgent treatments are left to suffer, and in some cases, these delays cost lives. The blockade not only creates systematic barriers to healthcare access but also leaves healthcare system highly vulnerable to other external pressures.
The ongoing conflict between Israel and Palestine has made the region unsafe and unstable, leading to devastating collapse of Gaza healthcare infrastructure, such as hospital and clinic that have been severely damaged by the medical intervention, leaving medical staff struggling to occupy with the current needs of the population. The effort to address malnutrition and preventable diseases are heavily impeded by the blockade and military intervention. A report published by the United Nations at 2024 highlighted the dire situation, with alarming numbers of children suffering from malnourishment and lack of basic access to life necessities. The repeated military operations have continuously weakened the Gaza healthcare infrastructure. The weak but functional infrastructure cannot meet the population need, especially during those escalation processes of violence. Also, humanitarian aid often delayed due to the military intervention. Hence, documentary want to ensure that we highlight the urgent need for the protection of the right to health and the provision of basic life necessities for the people of Gaza.
Everyone knows that water is a must for human beings. Since the start of the blockade, water shortage and contamination have severely impeded healthcare access, made people sick, and have already led to the outbreak of disease, creating a public health crisis. Healthcare and facilities in Gaza are struggling without clean water. The World Health Organization, which is WHO, warns that damaged water and sanitation systems, along with the lack of cleaning supplies, make it nearly impossible to prevent infection. Drinking contaminated water has led to rise in bacterial illness like diarrhea, especially in children under 5. A doctor at Al-Aqsa Hospital also said cases of dehydration are skyrocketing. The average person in Gaza is surviving on just 3 liters of water a day, which is far below the UN emergency minimum of 15 liters water. Since the war began, Israeli military attacks have damaged or destroyed 5 water and sanitation sites every 3 days. Gaza City has lost 88% of its water wells, leaving the population with almost no access to safe water.
Everyone has the right to a standard of living adequate for their health and well-being, as outlined in the Universal Declaration of Human Rights. The scenario above, we can see the devastating impact of military operations and blockades by the Israel in restricting Palestinian access to essential medical care, leading to increased suffering, disease, and loss of life. It is imperative for the international community to take responsibility in addressing this humanitarian crisis. International law, including the International Covenant on Economic, Social and Cultural Rights, affirms that access to medicine and healthcare is a fundamental human right. Actions by the Israel, such as destruction of medical facilities, targeting the healthcare workers, and the obstruction of the humanitarian aid are clear violations of international human rights law and the right to health. So, let us unite in calling for justice for the Palestinian people and ensure that their rights, dignity and access to essential care are upheld without compromise. Health is not a privilege, it is a right. Together, we can advocate for change and ensure care for all.